let's talk about the carnivore diet and the keto diet, and then the extremely low-fat vegan diet. We'll talk about some of these extreme fat diets, but yeah, they're dangerous. Really dangerous.
And so you, like, I want to be very clear, although you call it the Nutritarian diet, you see it as like a lifetime diet, like a lifestyle. It's not just a diet, it's a full-on intention behind what you're eating for the rest of your life.
Yeah, it's like, it's eating for health. We're eating for our own good health because we see our happiness is linked to our health. And if we're sick, we're not going to be happy. And if we don't have our physical and mental abilities as we age, we're not going to have a happy and aging. We're not going to be happy elderly years. Our golden years are not going to be very golden when we're in bad health. And everybody's in poor health in their golden years. It's coal years. They're what kind of life then is that? Then
Did you just make that up right now?
What's that?
Did you just make that up right now?
The coal years?
Yeah.
I don't know.
That was pretty good. I haven't heard that before. So like you're saying the golden years, like the years as you're aging, like what, your 60s to 80 or 50 on? Yeah. And you're saying it's the coal years, like those are where you just rapidly
75
decline.
to 95.
Yeah.
Most people die around age 80.
Right.
But we were able to live to be 95 to 105. And I'm saying the normal lifespan for humans is between 97 and 107 years old. That's the normal lifespan. But what's the point of living that long if you're not going to be healthy in your 85, 90s, 95? There's no point living that extra 15 years.
People are super sick in their 70s. Like, they're very unable to, like, live and enjoy life. I see it time after time. Your age and just in such poor health.
And they don't even do anything.
I know. I don't. And like, here's the thing. Everyone says, like, I don't care if, you take 5 years off, 10 years, but that is like not the situation. It's like you're sedentary. You aren't. If you took away skiing from you, you'd be like, I'm done. I'm out of here. And that would suck to just be like living for 20 years, not being able to live life to its full potential.
Do the things you really love to do.
Even if they're slower or different.
So you live 20 years less, and then you live an extra 10 years in bad health. So it's like living 30 years less.
Right.
Not even like living 20 years
They're not
less.
quality years. Yeah. And everyone deserves quality years.
Yeah. So the change, so we are health enthusiasts because it makes us more peaceful and more optimistic about life.
Why'd you put it in quotes? Why'd you put it in quotes? Health enthusiasts.
I was going to say health nuts, health enthusiasts.
Health freaks, as I used to say. Yeah.
But because it's fun. And it gives you more security and less fear, living with fear. I can't imagine being a normal person.
Yeah.
And being afraid of having a heart attack at any minute.
Yeah.
And then you have to go to the doctor going about breast cancer and prostate cancer and worrying about cancer and worrying about, and worry if I'm running for a bus. I mean, it's just like, can you imagine living with the fear of a normal person eating a conventional diet? And
not knowing. Well, you're leaving it to chance. And there's a slim chance that you could get out without any potential health problem. But the thing is...
No, there's almost no chance.
There's almost no chance. Damn. I'm always trying to be the optimist here.
The slim chance is almost like so slim. Let me get out. Some people live to be 95 to 100 years old. But
you hear those stories. My grandma smoked a pack a day.
It's so incredibly slim, like 1 in 100 people.
Right.
You know what I mean?
No, because you hear the stories. My grandma, my great-grandma, this person I know down the street smoked a pack a day, didn't get cancer. So I'm good, right? And you're like... I wouldn't want to leave it up to chance. What's nice is when you eat a healthy diet, it does give you a confidence. Sure, you don't know what could happen tomorrow, but it gives you a really nice confidence that you won't have to spend a lot of hours, a lot of time in the doctor's office. Yeah,
and every person that you know has family members that are suffering with cancer and heart disease, strokes, dementia, and all these problems that everybody in America gets if they eat the standard American diet.
Right.
Okay, then we have the people that switch now to the keto diet. And that is really... a dangerous fad.
Can we just talk about what's your definition of the keto diet to make sure we have the proper definition here?
Yes, it's significant enough carbohydrate restriction so the person actually goes in ketosis.
Okay. And so it's not so much about fat, it's more about the restricting carbs? It's
restricting carbs, and their diet is very high in fat.
Okay.
They're usually eating about 70% of calories from fat.
Okay.
And they're keeping carbs below 30%. Protein's about 10 to 20%. And
this could be any fat, unsaturated fat, saturated fat.
They're eating a lot of saturated fat, too.
Like a lot of meat. It's heavy on meat, heavy on butter, heavy on saturated fat.
And they can eat a lot of avocado and coconut oil and oils and things because they want to exclude calories from non-carbohydrate
pro-fat, anti-carbs. Got it.
Right, yeah.
So ketosis is when you drop your level of carbs so low?
Yes. So a lot of people, most people do lose weight on it. But of course, when they go off the diet, they gain weight back again. But it's very dangerous. Facts are that followed long-term over decades, people double the risk of having a future heart attack. Double the risk.
But that makes so much sense to me because you're eating high in saturated fat. This fat clogs your arteries, builds up plaque in your body. Why would your cardiovascular health be normal? That's what I'm asking.
Well, these people are distorting science because they're teaching people they're following their sugar levels in the blood. And if the sugar levels are down, that's what the most important thing is to them. But they don't realize they've developed insulin resistance. They've distorted the shape. It's because saturated fat interferes and distorts the shape and function of the insulin receptor. So now they're saying, well, if I eat a piece of oatmeal or a mango, my sugars go up through the roof. Well, yeah, because you distorted your insulin receptors. If you are on
wait. Sorry, I just want to make sure I'm understanding. Yeah. Ketosis, you're saying, changes their insulin receptor. So the things that are like accepting insulin and like letting it pass through the body to lower your blood sugar, it's distorting it so it's not working as well?
Correct. The insulin binds to the receptor, which allows glucose to go out of the bloodstream into the cells and into the muscles for utilization. So it keeps you need insulin to keep the glucose down.
Right.
So the receptor doesn't work well. So now the glucose doesn't go down well. So
now the sugar in the blood's super high.
If they eat carbohydrate. So they stay on eating meat and tuna fish and
because they've lowered it. So their body becomes used to less glucose, like less sugar in the blood because it's not there. And then when you do eat it, the receptors are all distorted because so it doesn't know how to process that high amount of sugar. Is that kind of
No, it's the high fat, particularly saturated fat in the diet.
That's
even though they're not body
it.
fat, the saturated fat distorts and damages insulin receptors.
I understand.
So now when they eat carbohydrate, they're going to have a more dramatic high reaction to it.
Okay.
But staying in ketosis long term is so dangerous. For example, a baby or a developing fetus is you can say a radar detector or a radioactive Geiger counter for things that are harmful.
Right.
Women shouldn't eat a lot of fish when they're pregnant because the baby could come out with some problem. Or, women shouldn't drink alcohol because if their baby's going to have some problem with alcohol. But the adult doesn't get the damage from alcohol. The baby gets the damage from alcohol. But we know that alcohol damages the baby and the adult, but the baby is the Geiger counter.
Yeah.
Like the text, it tells us that things are damaging.
Reaction.
The fast reaction, exactly.
Yeah. No, that makes so much. I've always said, like, I kind of buy baby sunscreen because I'm like, well, if we are saying it's bad for babies, I kind of don't want to do it either because obviously it's bad for me too.
In the long term, right. Exactly. That's what people don't get.
I know.
So
in the long term.
Here's this data on the keto diet. If a woman's on a keto diet up to the point of pregnancy or through a pregnancy, she increases the risk of neural tube defects by 90% with birth defects.
That is so
If she
scary.
stops the keto diet a year before she conceives the baby, she still increases the risk of birth defects by more than 30%. That's how dangerous it is.
Wow. Do you have any idea why that is?
Well, people think it's because you need folate, and the diet is very low in folate, but it's also low in phytochemicals and antioxidants.
Right. Why are you just isolating
And the cells
folate?
in the body and the baby's cells are going to be damaged. The eggs are going to be damaged when they're living there. We know that there's an explosion of autism and childhood cancer and acute blastocytic leukemia in children that's linked to the mother the diet eats up to 2 years prior to conception affects the risk of brain tumors and autism. So we're talking about unhealthy food, eating diets that are eating low vegetable content, and then people think they could take folic acid. But in any case, what I'm saying is diet controls the health of the offspring, and it's we know that this is particularly a dangerous diet. But then when we see studies which are finally coming out on keto diets long term, we see they're very dangerous long term.
Right.
Which the dangers are hidden. The long-term dangers are hidden by the keto community. There's over, how many people are on the keto diet? 23 million people in America? I think I wrote that down. Let me just check my notes. How many people follow keto diet in America? 23 million Americans on a keto diet. 23 million.
Americans?
Yes. 23 million Americans. Isn't that amazing?
So big.
Right.
That's bigger than New York City, right? Or
I don't know.
Me either. That's a good question, though. But I know, like, San Diego has 1 million people, so I figure, like, that is so many people.
Yeah.
Well, it's interesting, too, because I could show you about so many people I follow, but I follow a friend on Instagram who's very into keto, or, like, I would say it's keto. Yeah, high fat, low carbohydrate. And they all, they talk about, like, natural butter, natural cheese, like raw this,
Put
raw
butter
that.
in your coffee.
Yeah, butter in your coffee, but like natural. And like I hear them when they say we want to eat organic, not processed, like no pesticides. I hear them and I hear that they want to eat whole foods, good. But then when you look at like the meat, the cheese, the this, and then your education on saturated fat, I'm like, that makes so much sense. And if I ate that, coming off a Nutritarian diet and ate that, I would feel it immediately. Like I would get heartburn. It's so interesting that once you have such a clean diet too, you also feel the negative effects so potently, like so soon.
Yeah, absolutely.
So it's just crazy. And it hurts my heart a little bit.
There's even people on this, there's both the carnivore diet, there's the lion diet, there's all these diets that gain popularity with people, thinking that meat is good and vegetables and beans and nuts are bad, with a distortion of science. And people, how people could believe anything, and they don't really know enough to weigh evidence. They don't have enough training and education and knowledge to know the risks of what they're doing. And they have these people, even though we have, probably 30,000 studies showing otherwise, with 100,000 scientific and nutritional researchers showing it's safe, but they'll still believe this one or two doctor who has some degree behind his name telling him it's good to eat just nothing but meat or something. It's the craziest thing.
And you just have to be careful. Like, there's a lot of personalities that come into this, but whoever is the loudest in the room isn't always right. Which, don't get me wrong, you're quite loud. I've seen your PBS special, but I
agree with you 100%.
Yeah.
It's what's happened in the vegan movement. These people who are very bullies and who really are bullying, who really have a big voice and a lot of followers, take over the movement.
And can attack others, put other voices down.
And give people wrong information with attacking others and putting others down, because it's all about egos and your favor. It's really ugly. So the nutritional, this field.